Hi, my name is Mike Rizzo. I'm a doctor of pharmacy. Compounding is the art of making medication from scratch. When a medication is not available as a commercially available product, then you will go to a trained compounding pharmacist and he will put together a formulation to make that medication from the pure ingredients. Our approach to healthcare is more integrative. So we work in collaboration with physicians, dietitians, nurses, and other healthcare practitioners to ascertain the proper nutrition, exercise, and chemical balance in order to treat different diseases. For example, we prepare protocols approved by physicians that work with us. Weight loss protocols, hormone replacement protocols, IV nutrition protocols, just to mention a few. Our integrative approach to medical treatment and pharmaceutical services is what sets us apart from just a regular pharmacy. We believe in integrative medicine and we believe in preventative medicine rather than medicating every symptom that the patient presents with. In other words, because we are the experts in pharmacology as a doctor of pharmacy is precisely why we don't just medicate every symptom that we see on a patient. We'd rather try and figure out what the root of the problem is and prevent it rather than treat it. So we believe more in a proactive approach rather than a reactive approach to medical care. We need special training. All of our pharmacists are going through the fellowship program. That's how much we believe in A4M. Therefore, we actually give consultations. Physicians refer patients for us to give consultations to maximize that drug therapy rather than just continue adding to their regimen. We try to see what could be taken out because maybe you don't need it anymore once the patient is supplemented properly with the right nutraceuticals in place. For example, the patient is depressed, goes to the physician, gets a prescription for an antidepressant. In order for the antidepressant to work, say for example a group of them, what is known as the SSRIs, selective serotonin reuptake inhibitors. What it does is it blocks in your brain a normal function, which is reuptaking the serotonin. As an expert in pharmacology, I can tell you that you are blocking something that was supposed to be happening normally in your system to correct a symptom. For example, in this case, depression. But is that really treating the root of the problem? Not really, we're just patching it up. So what we do in this case is we try and get to understand why is this patient depressed. Okay, what is the age of the patient? We go through a thorough history and physical, and we evaluate what is the cause of the problem. If the problem is hormonal related, is the problem nutrient depletion, and a lot of times it's just not one problem. I mean, we have to understand that, for example, 70% of our immune system comes from our gut, comes from our intestine, from our GI system, and yet we go out and we're eating things that are loaded with sugars and trans fats and continuously insulting our system. Eventually something like this would happen. Maybe the imbalance is happening at the cell level, and it's just a depression. It's just the way that your body is expressing the problem, but it is not the problem. So what we try and do is we try and find out what the problem is instead of giving you something that would correct the symptom, make you feel better for some time, but in the long run it will deplete you even more from other things that you need to properly function.